Hey everybody, it's Leslie with Positively Apex and Greet Friendship Magazine, and I'm here today interviewing one of our business partners in the community. The name of the business is Blissful Lifestyle Medicine, and the owner and practitioner is Dr. Alicia Chitanand.
Yes.
So thanks for joining me today. We're green and black boot
Yeah,
twins today,
yeah.
so we did not plan this.
We had the vibe there, you know.
Yeah. So it's a cold day, so
Yes.
we had to bundle up. But so she is fairly new here in Apex, and like really new, but she's got a history in the medical field. So tell us about like your past before you started this business. What did you do in the medical field?
Yeah, so I'm a physician, so I went to medical school in Florida. I did my residency in family medicine in Virginia. Sports medicine fellowship I did in Greensboro, North Carolina, and then I worked as a family and sports medicine doctor in Holly Springs for 5 years before branching out on my own. I realized I wasn't taking care of my health as well as I would like to, so I started investigating, how can I be more healthy doing just lifestyle changes. And then I stumbled upon it's kind of a new specialty of lifestyle medicine, and I think it's much needed in this area, in this country. So it's prescribing lifestyle changes and kind of meeting people where they are in terms of lifestyle, so that we can make it work for you, so you can be the healthiest that you are. And as I was doing it for myself, I was like, well, I'd like to do this more for others, so how can I do that? I was trying to do it in primary care with some success, but I really think to get to my full potential of helping people with lifestyle medicine, I decided to branch out on my own so I could really get to the root cause of.
Also, having your own business allows you more flexibility and family time, right? Because you have two young girls.
I have 2 young kids, 2 little girls, ages 2 and 4. So yeah, I also realized that if I wanted to practice the way I wanted to, I was having to choose between spending time with them or spending more time with my patients, and there's just no comparison. I want to do both.
And also, I mean, the insurance world, which is a whole nother topic, is just a pain for practitioners to deal with. But luckily, a lot of people take it, but some people that are more specialized don't, because they can actually give better care because they don't have to worry about taking that time with the insurance company with all the rules and the hoops and all the things. And so then they can actually make it cheaper, or like, how does that work? I mean,
so if you work with insurance, they kind of decide how much they want to pay you. So if you want to keep the lights on, realistically, you have to see more people. So it's, no fault of anybody's that's in, the insurance model, but you just have to see a higher volume. So I would like to spend a little bit more time with my patients, or also if they have questions, have more time to help them look up answers, so that I can help them the most safe way possible. Also, my patients can submit visits with me to their insurance separately. So it does take, then the insurance will pay for some of it. So that does make it a little more affordable. And I also, next year, so starting in 2024, want to do a new structure to make it, my goal is to make lifestyle medicine more affordable to everyone. So one step I'm doing is I want to do a membership and we do, with that comes group visits, where I talk about a topic of choice, and then people can ask questions at the end, and then Also, there'll be small groups for accountability. And then if people are like, hey, I would like more customized care, I want more one-on-one time, they can elect to do that as well. So it's going to be kind of a tiered approach so that it's a little more affordable for more people.
Awesome. So tell us more about the different services and techniques you use. I know you have an in-person option in the office. There's a table here, and then she also does telehealth. So tell us what you use for what, and how do you know if you need telehealth or in person?
Yeah, so, well, I haven't even gotten to the table part. And I also, I'm a DO, a doctor of osteopathy, so I do osteopathic manipulation, which is a form of hands-on treatment to help resolve acute or chronic pain. So it's similar to chiropractor, massage therapy, PT, hands-on care. It's similar to those, but a little bit different. So that has to be in person because it's hands-on care. Lifestyle medicine honestly could be in person or telehealth. It's kind of up to the patient. If they prefer in person, then they can see me in person. If they want to do telehealth, I basically send a questionnaire of all the pillars of lifestyle medicine, kind of going through them. So that's nutrition, physical activity, sleep, stress management, social connections, and talking about risky substances such as smoking, alcohol, and drug use. So we get the questionnaire, and then we go over it, and we come up with strategies with whatever the patient would like to focus on. It's very patient-centered, and I really try to make it customized for each person.
So until I met you, I'd never heard of lifestyle medicine. So in doing networking and things with you, it seems like I'm not the only one.
Correct.
And so you're kind of a trailblazer here. So how does someone know if they or someone that you're talking about things, or maybe their health problems or goals, health goals, wellness goals, how do they know? Say, oh, I know of this lady, Dr. Alicia, you should try to see her. What are some cues?
So I think if you are a person, or you know of somebody that wants to take a more holistic approach to like high blood pressure, high cholesterol, or if you want weight loss, diabetes management, and you want to try lifestyle changes, among those pillars that I mentioned, or you want somebody that's going to be able to spend a little bit more time trying to get to the root cause, that's when I'd see them. Or if they're already on medicine and want to try to do their best to come off of it safely under the guidance of a healthcare practitioner, because I can prescribe medicine. My goal is to de-prescribe, but I don't want to do it unsafely. So we want to do it as safely as possible. So those are the types of things that most people. I mean, 2 or 3 years ago, I didn't know what lifestyle medicine was either. So it is a new field. And then for manipulation, it would be. I mean, anybody with acute or chronic pain, or just needs relaxation. I also got my yoga teacher training certification this year, so I am incorporating some of the kind of yoga meditative practices in that. I also will do that at the beginning of lifestyle medicine visits to kind of center ourselves if the patient wants to.
Okay, and what about demographics? Like, are this a certain age or anything like that?
I typically have worked more with adults, so I have done more with women than men. I have done a lot with both genders, but I would say like usually women between like 30 and 60 I've done the most with. I also have worked a lot with pregnant women as well. So I'm not an OBGYN, but doing lifestyle or recommending lifestyle changes, or even the manipulation I do. I do actually enjoy treating pregnant women, because I know what ailed me when I was pregnant, so I got to know how to treat the common things and do it safely, because I know what positions to avoid and things like that.
Awesome. Is there anything else you think we missed that you want to She will be featured in an article in our January 2024 issue of Greek Friendship magazine, so check that out when it comes out. Working on that now, and
yeah, I think, you know, if you have any questions about lifestyle medicine, feel free to reach out to me, because there's a lot that I can do with it, and some of the things that I probably haven't covered.
Mm-hmm.
And if I'm not sure, then, you know, I can always help guide you and look things up with you. So I am all about walking through the journey of wellness with my patients.
And you have a lot of referral partners in the wellness and health field, so like if you can't help them, or maybe something in combination, you can refer to, right?
Oh, absolutely, absolutely.
So where do we find you?
So I'm located in Apex in the 540 Business
Flex Park.
Yeah, Flex Business Park.
Olive Chapel.
Yeah. I'm in Olical Health, OLICAL Health. I'm share an office there, and I'm there Mondays and Wednesdays. And then you can go to my website. It's www.blissfullifestylemedicine.com, and that's where you could sign up for appointments. My phone number's on there. You can send a message on there, so you can contact me on there, and it comes to my email, so you'll get to talk, you know, message me directly. And I also do offer a free discovery call. So if you do have, it's more to see if we're a good fit, or if you're like, hey, I don't know if this is for me or not, then feel free to, if you message on that, I'll get it, and I'll be able to help you, or call the number, and I will get it, and I'll be able to call you back.
Awesome. So the holidays are here and coming up quickly, and so give the gift of health, you guys. So
Yes.
print off, you know, her picture and put it in somebody's stocking.
Yes, exactly.
So you need to go see her.
Yes, exactly.
You know, for those relatives that that complain all the time about something and they just won't do anything to help themselves. So maybe you'll be the push over the edge, right?
Yes.
Anyway, all right. Thank you so much, Dr. Alicia, for joining me today, and we'll be talking to you later. And I'm excited. She's actually going to do a session of manipulation on me, so
Yes.
I'll be able to report back and tell you how I feel.
Okay.
We decided to video part of my manipulation here, you guys. So
Yeah. So remember this part, you are not going full force.
Okay.
All right. So I'm just lifting your leg up here, and I'm checking your back here as I do it.
Okay.
Just monitoring. And so you're gently going to push your knee into my shoulder. And relax. You're very good at following instructions. Push your knee into my shoulder. And relax. And then push one more time. And relax.
You don't want me to do really hard for the blooper reel?
Yeah. No, not today. I might not be able to finish your treatment then. No, I'm just checking the front of her hips. Oh, wow. That's all right. It went out pretty good. You know, you didn't need much. I'm still going to treat
I got
the
good
rest.
hips.
Yeah, I'm still going to treat the rest, but... All right, now you can just let me, I'm just going to move your leg in a circle.
Okay. Do your thing.
And I like to check progress every time. And then the next thing you're going to do is make it's like a tree pose, or make a 4 with this leg out. Yep, perfect. And yep, put it here. And then I'm going to I might be blocking their view, but I'm going to come on this side and just keep it in plane. You're going to run your foot down your leg. All right. Okay, well, you're evening out, but this hip still feels tight. So I'm going to do her other side, but this is just kind of a glimpse of one of the things that I do. Thanks for watching.